Good morning, everyone, and welcome to today's session of our physiotherapy classes. I want to thank everyone who is available today. I want to thank specifically our doctor, the head of our physiotherapy committee, Dr. Rotimi Karim, for his sacrifices in seeing that our musculoskeletal aspect of management is handled well. I want to thank you for last month's session. I know everyone who joined last month definitely had one or two additional knowledge to what we know about our joint health and how to handle them. I also want to use this medium to say that as persons with bleeding disorders or caregivers, importance. 80% of bleeds associated with hemophilia is in the joints. And that's where always the complication comes from. Aspect of your management that you cannot joke with. If you have good joint health, then you can be sure that 80% of your problems as a person with bleeding disorders is settled. Those 20% are what happens from trauma, but your joint health is very, very important. So without waste of time, I told us, for those of you who read my charts, to come with your questions. And if you are a parent, to make sure that your child is there with you, because we cannot explain what we are not seeing. Those that were here in January saw that Dr. Karim needs to see the child. You can't just be explaining. So if your child is not close to you, please call the child, let the child be close to you. And if you know you have to show a joint and maybe it's your knee, I will advise that you get yourselves a pair of shorts rather than wearing a long trouser, so that it can be easy for us to view that joint. That should actually be one of our dress codes when we are coming to this class. You come in shorts so that it's easy for the doctor to see those joints if he needs to assess your joints. So I'll hand over to Dr. Karim to continue with the class. Thank you, sir.
Good morning, my ED, and good morning to everyone listening to me all around the country and even further than Nigeria. I just want to say a beautiful morning to everyone and to our community, the bleeding community. It is another beautiful Saturday to see ourselves and to move in this journey of rehabilitation, habilitation, strengthening and improving our overall quality of life. It's a thing of joy. The last lesson that I can see that many parents, they picked a lot from what we did last month. In fact, this morning, somebody woke me up with the video of our son, the position, and it was an excellent video. I'll send to the ED as time goes on so that she can help us share and we'll see. And these are what we want to be doing. As we are doing, let us encourage ourselves. Let us give feedback. The feedback is nothing other than to help us further. Like we started, you see that I emphasize so much on the knee joint. And why am I doing so? Is because even the research conducted here, at least to the glory of God, we've done studies in Nigeria since we started this movement. And we found out that it's conforming to that pattern, so that the knee joint, when you are talking about the lower limbs, when we say lower limb, we are referring to the region from the hip down to our feet. So from the hip to our feet, it has been discovered, and up till now, it's still being covered that the knee joint is the most affected. Now, we look at something last week, and that is to serve as a guide and introduction to all of us. We look at the knee, and I gave a simple positioning method that I've been researching on for the past 3 to 4 years. And like I said, hopefully we should be able to conclude a study. We should be able to conclude a study this year, and then we can present it to the whole world as a novel approach from Nigeria. And it's been working, it's been very, very effective. So the joints, what we started last week is to approach the flexibility of the knee joint via stretching the hamstring muscles and the back of the knee, that is popliteal tendon. Usually because the hip flexors, they react to injury by shortening. They just react and they become shortened. And this gives a lot of tightness. We call it contracture. Once you're having this, it means that place, and that's what we witness in our children. They tend to bend the knee and walk in a funny gait. Because of the pain, we call that antalgic gait. Because they are walking, they are feeling pain. So they tend to move fast, but that knee joint remains bent. Naturally, it should not be bent. For you to bear weight and have your full posture, you should be able to stand straight. So if you observe most of our people with hemophilia, they tend to bend the knee and they walk that way. Now, for you to stretch this type of joint, it becomes so painful for them. So we are still working on our knees. I observe that once our knees are well stretched, once our knee joints are straight, and the muscles around, I mean the thigh muscles, we tend to feel better and we can still move around and these children can still play. So that I'm just trying to let us know why we have to overemphasize the knee joint. It's very tangential because it's the most affected joint in the lower limb. So we have to concentrate on it, and we are going to concentrate on it in a kind of 3 or 4D manner. Number one, we look at the flexibility. Number two, we look at the mobility of that joint, the joint surface. Then number three, we look at strength. Once we talk about strength, we are talking about the strength of the thigh muscles, back and front. The one at the back is called hamstrings. The one in the front is called quadriceps muscles. So we are going to focus still on that. The one we did last week was to focus on flexibility, that the back of the thigh muscles, they are tight. That is contracture. They are tight. And once they are tight, the child cannot stretch out. And I'm very sure it worries most of our parents. They say, look at the way he's bending his leg. Look at the way he's walking. He's walking like a lame man. He's not walking well. I don't like this. I don't like that. Well, I share part of your worry, but the good news is that your child can attain a full stretch of the knee joint. I am very sure of that. It's not a guesswork. We have research works, and we have done it in many children with hemophilia in the past, and we are still doing it up to now. Last week, I had a patient, just this week, I had a patient from Ekpe. I saw her. She was unable to join. I believe she should be joining this morning. So I gave her a program. I saw the child myself, and we did a lot of things. Right there in the clinic, before she left, we've had increment of about 10 degrees in the range of motion of the knee joint. Just spending like 30 to 40 minutes in the clinic, we gain up to about 10 degrees of extension of the knee joint. So, which is a lot. And I told her, just keep doing this every day. Once you are doing this every day, so by the time we leave the issue of flexibility, then we move to strengthening. Because as we are stretching out, we want the muscles around that joint to be strengthened. Then after strengthening, we move to proprioception. Proprioception is simply knowing the position of your joint in the air or in the space. That is, as you are moving, you know you have to stretch at this point, you can stretch. You know you have to bend at this point, you can bend. And when you are walking, your pace, your movement is not awkward because you, with your brain and the command from your brain, you can gauge and know where your leg is going to be placed. There is a major problem too. So by the time we leave range, we started with flexibility training, where flexibility, we now go with range of movement. Then from there, we move to strengthening. From strengthening, we now move to proprioception. So I just want to suggest that we start this way. For those of us that attended this class last month, that is January. Now, I just want, so we'll just give a gap of the next 10 minutes because we want to manage our time strictly. 10 minutes, let me have short feedback from all of us. That is for those that are ready with their children, what you have seen. Have you seen any improvement? Have you not seen any improvement? It doesn't matter. Even if you have not seen any improvement, please let us know. And you show us what you have been doing so we can help you before we move to the next phase of the class. So what we did last week is to stretch the tight muscles using positioning, starting position, lightweight, and commands for the child. So this week, I want us to discuss, let us have a feedback of all of us that have done something with our children since January up to today. So can we move now? Hello, Hal.
So if you, for those of us who joined in January, if you know you have been practicing and you have a feedback on.
Yes. Hello.
And can give us what it has been. Madam Okoye, please mute your mic. I'm muting you and you're muting it again. The background noise is disturbing. Leave your mic muted if you are not saying anything. So if you know you were in the session and you want to tell us what has been your experience in the past 1 month, have you been doing it and what has been your experience? Indicate by show of hands so that you can ask.
Good morning.
Please mute your mics except you want to talk, please.
To talk.
Okay, Toby, you said you were not in the January class. So the video is on our YouTube page. I posted the video on the YouTube page and I put the link so that people can go and watch it and see it. Yes. Mrs. Ezike Eukaria, unmute and you can tell us what has been your experience.
Good morning, everyone. Good morning,
Good
Dr.
morning.
Kari.
Morning.
Good morning, Ma. It has
Good
been
morning.
a very good experience for us. It has been a very good experience. We've been using the method, and the leg, there's a very good improvement. The leg is improving. We time him. He does it morning and evening during the week. Then on Saturdays, we do like up to 3 or 4 times, 15 minutes apart or 20 minutes as his strength can carry. It has been a very good experience. There's been a good improvement. I sent a video to Dr. Kari this morning. He too can attest.
Yes,
Oh, you didn't send me the video, madam. Send me the
I'm
video.
so sorry, Ma. I will send you, Ma.
So, yes, I'm going
No
to send,
problem.
send
No
the video
problem.
to Madam now, so that it's part of what we can show this here.
Exactly. That's it's a good
Mm.
that's all are the things that we need as evidence to show that what we are doing
Yes.
are working. Thank you, madam, for that.
Exactly.
Testimony.
Thank
Thank you. Who else was in the session and has been doing it? I know some people were there at that session. Emmanuel Ekpedo, you said that's exactly what you are dealing with your son. So go back. I will still put the link of the YouTube here and on the WhatsApp pages. Go to the YouTube channel, watch the video, see the technique, and start practicing it. You can just hear from a mother saying within just 4 weeks, she's seeing a significant improvement by just doing that simple stretching technique that does not require you buying anything. You don't need to buy any material to do it. It's basically what you have at home that you are using for it. So do we have any other person before we go on?
Okay. In the absence of any other person, then we should be able to move to a range of, like I said earlier on, that the last one that we did, contraction of the muscles around the knee joint. The challenge is that people with hemophilia, we tend to always bend. Mind you, it is not something that they can control totally, but we can encourage them through all this positioning, because that at that point in time, that is their position of comfort. There is no person on this that does not like comfort. Pain is pain at any point in time. And once you are feeling pain, if you figure out a position that will, you will assume that pain automatically. That is now how we function. Unfortunately, position of comfort and position of comfort are always in all. Now, what we need is function. But because of the pain, people living with hemophilia or turn the other way around, because they are getting comfort of reduced pain or no pain at all. So this position all the time, even while they are sleeping, to stay in this position. And the more they stay in this position, the faster function. And that is why you must understand all these things we are talking about. It's possible to break down those terms. You see, I avoid using a lot of I found a way of breaking them down. So everyone will understand and must understand, because that is what will stimulate you to do more. Once you see your child in a particular part of the body, either the elbow or knee joint or the hip joint or the ankle joint, you even pain. You say, John, are you having any pain? He said, no, mommy, I'm okay. But you can see yourself that folding part of the leg and the hand. So that should give you a direction that this child must have felt pain earlier on, but now trying to look for a position with reduced or no pain. So once you start observing this on your child, you should know that that child is passing through something. So you now move in. The first thing we do is to find a way to relieve pain. Using the physical means, we have our hygiene, and then we can go to the hospital immediately. Our physio, the emicizumab, and other treatment stabilize the system of the child. So after this is done, then you move immediately to flexibility. That type of the muscles or the tissue affected, either in the leg or in the hand. No, but for the purpose of this class, we are still considering our knee joint. So once you observe that, you know you have to start this positioning. Then once you have gained, even if it is just 5 degree, range of motion, then you have to maintain it. How do you maintain it? After lying down, whatever the child had gained, our pattern. And the pattern is that then you now start telling the child, it may be in line or what we call long sitting. Now, I'll start showing that now. Maybe in line or long sitting. So I'll show some things now so that we can get this. So once we've started, what we did last was flexibility training. That what we are going to do now, is range of motion. So I'm going to recap by doing this. Just watch me. Okay, place your hand. After we might have done this, so let's assume that we're having this before. Now, if we're having this, please, are you seeing this? Everyone, are you seeing this?
Yes, we can see, sir. We can see.
Okay, now, after you started doing this, so you are going to add one thing again. So after your exercise, it is expected that at least, even if it is 2 degrees or 5 degrees, we will have gained. Next step will now be, you ask the child to turn and lie down from that lying position. So you are going to have something closer to this. You're going to have something closer to this.
So in that position, the video needs to come down to you a little. Okay, yes, sir. Now okay. It's okay now.
Okay, we can see. Okay, so with this, completely stretched. To instruct the child up, then move down within the available range. Please don't force it. Within that available range, whatever we have gained from that flexibility by stretching with the position, the first position, then we move to range of motion exercise. Whatever we have gained, be it 5 degrees, 3 degrees, 10 degrees, then we begin to exercise on that range because we want to maintain that range. We don't want to lose that range. We want the range to be there all the time. And that's very simple. See, look at just 3. You encourage the child, don't worry, just push it forward, don't force. Bring it back, up, then down, up, then down. You can see within that available range. Don't say because don't force. I can assure you, you are going to get the best by following all these instructions strictly. The child will regain and maintain that full range. And until the whole leg is stretched, then we keep. Now, the more we get that stretch, the more flexible the muscles of the thigh and the back, the front and the back, the more the range
Sir,
to this
please,
level. So
please, sir, can you bring down the video again and then let him have? Some people are saying they didn't see when you were showing how to go up and down. Video went up.
Okay, let me put on more light. Okay, I'll do that now. Let me just put on more light so that we can have everywhere well brightened. So, what we are saying is this. So, after the first position, Mrs. Azike, please send the video to our EDO.
She has sent it to me already.
She has sent it to you?
Yes.
Beautiful, because you are going to help us share the video.
I will share it, yes, sir.
Yes, I want them to see something there that she did very well. And we are trying to improvise a full material. That are very cheap things. We don't want anything to be expensive for everyone. Just cheap material that you can do it by yourself at home. And then we keep collecting the data. So the next phase will now be, we start recording the range of movement. Yes, if they cannot use goniometer, we can use tape rule.
Tape rule, yes.
We'll start using tape rule. So that as they are gaining more range, we'll be recording with tape rule and we'll be converting to degrees. So can we see this now?
A little bit down, sir.
Okay, this way?
Yes, sir. Yes, sir.
Okay. So after the first position, we now move in that available range. Don't force anything. Just tell your child, move up, then down. Slide down, slide up, down, slide up, and down. That's available range. Don't force anything. So which means you start with the one, face down, please. Yeah, raise up with that. Okay, so let's have this. You start with this. Then after this, you can have a rest of say like 20 minutes in between. Then instruct your child to now lie down. We can use two positions here. Face up, Joshua, face up. Now we can have two methods here. One method is this. Within that available range, up, then down, up, then down. Now, for an average child between 7 to 15 or even up to 18, you can do repetition of 10, and you have in between rest of 2 minutes. You can repeat this up till 5 times, and that 5 times is okay. Can you get that dosage? Now, for an average child, you can do this repetition. The repetition is this: 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Allow the child to rest for the next 2 minutes. You repeat this minimum of 3 times and maximum of 5 times at the beginning. So as the child progresses, we increase the number of repetition. Now you can sit up a bit. Sit. Now rest on your. Then this is the second method. You can ask the child to sit down. Rest on your halfway. Just rest on your hand this way. This is long sitting. This is called long sitting or half lying. So you have the leg this way. Down. So you have the leg this way. So it is still the same thing. If it is convenient or more comfortable for the child to be in lying, to lie on a mat or on a mattress or on a couch comfortably, leave the child. But if the child can sit up this way, If he's sitting up, it will be in more control. So if you just lie down, then hopefully, wait. Relax. So down and up, down and up. So just instruct the child. Can you see me, please? Sorry.
Yeah, we can see you.
We can, okay. So
Yeah,
you just
we can see you.
Okay. So you just ask the child to do this. And the dosage
It's better like this, we can see you.
Hello?
It's better this way. The
Okay,
position is better this way, we can see it clearly.
Okay. So now, the dosage is very simple. Like I said, whatever we have gained from the first position, you instruct your child to move first any movement. If what you have gained is just 3%, 3 degrees, it won't be that much. It may just be a little movement. Take it like that. Just instruct the child to move 10 reps. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Allow the child to rest for another 2 minutes. Then you can repeat this for a minimum of 3 times, the maximum of 5 times. So we continue on that. So I want to get feedback if we really understand what I've done so far, because we are moving faster today. From that range of motion, we are moving to strengthening too. So that once you start flexibility training, you move to range of motion, then we now move to strengthening.
All right, sir. So if you have a comment or question from what has been demonstrated, you can do that by show of hand. Then I'll call you because we want decorum. There's one Hawaii P30 light with your hands raised. You can mute and ask your question.
Okay.
Hawaii P30 lights.
P30 light.
You have your hands raised. Do you have a question or a comment? Okay, it's not responded. Do you have any other person who has a question from the demonstration?
Yes. So let me know if
Something that you don't understand from the demonstration and you want clarity. You can raise your hand so that we can give you time to ask your questions before he continues. No questions? That means we all understood.
Any question, please?
Yeah,
Please,
I
said, raise your hand so that I can call you.
Okay,
We don't want the place to become rowdy. Raise your hands, then we'll call you to ask your question, please. If we don't follow it one by one, everybody will want to talk at the same time. Godin Ogulewe, please go ahead.
Okay.
Go ahead, Mr. Ogulewe. Mr. Ogulewe, please go ahead.
I'm not sure he's hearing us.
Maybe his network has freeze. Is there any other person while we wait for him? It's his network. He has actually exited the class. Okay, Abibat Afolabi, please go ahead. Abibat, unmute and go ahead, please.
Hello, ma. Good morning, ma.
Good morning.
Yes, ma. Ma, please, I have a question.
Go ahead, madam. That's
okay. Okay.
Go ahead with your question, madam.
The boy is unable to squat very well. It will just squat halfway and it will stop. And it has been happening. It's up to 5 years now. He's unable to squat.
Okay. So that is number one. We're having two things.
Okay.
Problem with the joint surface.
Okay, sir.
Problem with the patellofemoral ligament and the hamstring too. They are shortened. So if he's trying to go down, there is a point that he gets to, he has pain, severe pain, and he will stop there. So we're having challenge with the joint surface. Listen carefully, man. Joint surface, there is problem. Patellofemoral ligament is that ligament on our on the top of our knee. There is a small bone called patella. That's the whole muscle in the front called quadricep muscle. Everything ended in the front of our knee. So that's the ligament there is very tight. Then the hamstrings, they are shortened as well. So we need to stretch out the hamstring while the patellofemoral ligament is overlapped. So because of that pain, you have pressure of the patella grinding on the surface of the femur and tibia. So once the child is trying to squat, once he gets to that point, he will quickly get up. So we are going to start from the initial position. Can I see your son? Can we see him now?
Madam, your son with you. Can you turn on your camera and show the boy? Mrs. Abibat. Mrs. Abibat.
Let's see your son. Maybe the ED man, maybe you can be sharing the video of Mrs. Asiken. I want people to.
We have two people that still have their hands up, sir.
Okay, okay,
so
ma. Okay.
Mr. Gulewe is back. Please unmute and ask your question. Then I think Emmanuel Ekwedo also had his hands up.
Okay, ma.
Yeah, can you hear me now?
Yes, we can hear you.
Yeah, I want to thank you for the section. So I think I've been encouraged by the lessons. But my son, he has that knee problem, and I introduced one of my physiotherapists into this section. I think you're worried. My issue, the question is do my eyes?
So turn off your video, maybe to help your network. Your line is cracking. Just turn off your video for now. It might help the audio.
So what I'm saying is that do we still have to
go ahead, sir? Hello?
Okay, network glitch.
Apply eyes before. Can you hear me?
Yes,
okay, now we can hear you.
Right.
You said, do you still have to do what? We lost you there.
Apply eyes. Apply eyes on the joint before the exercise.
Well, it all depends, sir. Now, what I'd advise, if they're having pain, or let's say moderate pain, you can apply your eyes before they start. But if that is not happening, go on and do your exercises. Then, after the exercise, eyes. Yes. Apply the eyes as a prophylaxis. Yes. Do you get my explanation?
You,
you're welcome.
Yes, sir. Yes, sir.
Okay.
All right, sir. Emmanuel Ekwedo, you had your hands up.
Yes, ma. Good morning, ma. Good morning, house. I had a question I wanted to ask, but the last person that asked a question is exactly what what we are going through presently in our home. The knee swelled up, and I wanted to ask why we are having this exercise. Do we still need to apply ice? So that's the question I wanted to ask, and it has been taken care of, ma.
Okay,
thank you, doctor.
You're welcome, sir.
We have two questions in the chat. The first one said that his question is, won't there be any pain and bleed if he does the exercise after doing it?
Okay. Now, with this method, and that is why this method is carefully coined out. When we started, we found all sort of complaints. But this method, if you follow it the way I've told you, you are not going to have any pain. Ask Mrs. Asike when she first brought her son, because of the previous experience with another clinic when they didn't know the boy had hemophilia. So the first time the boy saw me, he was almost running away. So I just told him, don't worry, you are not going to have any pain with this method. Just lie down by yourself. I didn't even touch him. I just gave him instruction. The only time I touched him was to pad him and pet him. I just got a towel, made a ring. I said, don't worry, this is what we are going to use. And lo and below. So after the first 15 minutes that he discovered there was nothing forceful, there was no stress, then he started adjusting. If you follow this method very well, you'll see that all these methods, they are more, the child is in more control than even you and than the physiotherapist. The child is in more control. The child is more independent to take this. The only thing you need to do, that I encourage parents to do, is that give them phone to be playing game. And before you knew it, the whole thing is being achieved passively, because we are using a specific positioning method assisted by gravity. The other one, you just give them instruction. Try and push out, take it in, push it out by himself, not by you. You just give the encouragement. Don't worry, do it more. It won't be painful. Okay, if you are feeling pain, let me know. And once there is pain, stop there. But you see, the better advantage about this method is that it's not going to be a sudden thing. But I can assure you, the effect is going to last very long. I can assure you that. It's not a guesswork, it's been tested. And I told you that maybe before the end of the year, it's going to be published as a novel approach discovered from Nigeria. It's what I've used over the years for all this year, and that worked excellently for all of them, even from the coming one. So the child is not going to have pain with this if you don't force anything. As you will soon see in the video that our ED will share, the only thing there is that I knew as parents, we are always anxious. But I've always told us, don't transfer that your emotion to help your child or our children in exercise. You are not going to gain anything from it. The best thing you can do is to be principled. Follow instructions. As simple as that. You have to do it. No. Follow this. You are seeing me. The instructions are clear. Lie down. Put your legs here. Okay, take this phone. Be playing your game. We are going to do this for the next 25 minutes or 30 minutes. Mike, please cooperate. I'm going to get you ice cream if you do very well. If you do very well, we are going to the theater together. If you do very well, I'm going to give you. So attach reward, not force. Attach reward to that activity, not force. If you do it the way I've given you, the child is not going to experience any pain.
The second question, I think it's goes almost in line with what the other woman asked. He said, for someone like me, I can't kneel, squat, or bend my joints so well. I don't take bikes. And if I have to take it alone, I will need help.
Okay.
This is from Toby. He's about 21. He's 21, 22 years. I think I know.
Okay. 21, 22 years. Okay. Let me see if it's the Toby I even know.
It's a Toby you know. It's Toby.
It's Toby. Okay.
Toby in Ibadan that comes to Lagos is him.
Okay. And then if it is Toby I knew, then it's been quite. Okay, let me say this. It's quite a long time that I saw him. Or even after that, if he's on, let us see your joint. Because the three areas that we keep looking at especially the knee joint, is that it's a major weight-bearing joint. That's number one. And we must all know that it just have 1 degree of freedom. You can only bend and straighten it, extension and flexion. And it doesn't have so much muscle crossing the joint. Unlike when you look at the hip or you look at the shoulder can permit movements in all directions. Likewise, the hip. You see, the hip can move. But you look at the knee. It's just, look at the elbow. The same thing affects the elbow. It's just out, in. So for those joints with 1 degree of motion, well, that is the sacrifice the joints have to make. Unlike those ones that are supported with layers of muscles. The hip, supported by layers of muscles. The shoulder, supported by layers of, and they are called ball and socket. So it means they can move, they can rotate, they can do all sorts of movement. Unlike the elbow and the knee joint. It's just 1 degree of freedom. So for joints like that, we look at the joint surface, especially the patella in relation to the femur and the tibia. We call the first one patellofemoral joints. So the femur and the patella, where they articulate, that is where they move. The tibia too. And they have compartments. So once such people with hemophilia, we need, whether you like it or even it's just once, then we can now continue others online like this. You will need thorough, as comprehensive and thorough assessment so that we can detect where you are having the challenge. Is it on the medial side? This is the medial side. Look at me. On this inner side of the joint, you have this. This is the medial. This is the lateral. Now, we want to know if it is the medial or the lateral or it is the patellofemoral. That is the front side. So we want to be sure of where you are having challenges. We want to be sure, are you having severe joint damage? That is arthropathy. We want to be sure, are you having synovitis? That is when the knee is bulgy. It will look so big and wide. But at that point in time, it is painless. So we have to know the stage of pathology before we can intervene. It is not enough to say, I cannot squat, I need to bend. What is stopping you from bending? Is it as a result of muscle tightness? Is it as a result of the patella being stuck in the femur and in the tibia? Is it as a result of synovitis? Is it as a result of pain only? And we must trace all this. So it's a bit complex. Anytime we are doing assessment, we have to isolate the cause or the causes why you cannot do a certain thing. So for Toby,
he will call you. He will call you, sir, after the meeting. He said he's in a busy place where he cannot show his joints. But after the meeting, I told him to reach out to you so that he can book an appointment, sir. Yes. Emeka, you have your hands up. I think that will be the last before we continue. Emeka, unmute and ask your question, please.
Okay, good morning. Good morning, Ma. Good morning, doctor.
Good morning.
Thank you for the program. Last time I was participating, but I couldn't be able to hear anything.
Okay.
So, but now based on what you are teaching now, I'm an older patient. I am 41.
Okay.
Oh, I have this knee bleeding.
Okay.
Over the years, but it seems the knee had been kind of bent, and it's remained like that over the years now. I cannot be able to stretch it very well or bend it very well.
Okay.
So in this case, I don't know, because I don't know if I can be able to put video so you can see the knee.
Yes, you can do video. Let's see if you are willing to show us.
Show the video, show the knee, but I also ask you to take a step further. Emeka, you are in Lagos. Dr. Kariri is in Lagos.
You are in Lagos. If you are in Lagos, then you can see me. It's very easy.
But show him, let him see. Then he can book an appointment with you and do a full assessment.
Okay.
So you can turn on your video to show him if you are comfortable.
You can turn your video.
So can he see the knee and the
this is the knee. I don't know.
Let someone else hold the camera for you.
Let somebody help you to hold the camera so that we can see, or you put it very lower so that I can see the joint very well. Okay.
You have to turn it to him. Reverse the camera to the back camera instead of the front camera.
The back camera, yes.
If someone is viewing it, you have to use the back camera.
Just click on the camera, just turn it around.
I'm coming. I can't even get this.
Okay.
It's not showing this thing. Okay.
The back view of the camera. Then let her turn. Let her.
Yes, I'm able to.
Yeah, so now I see. So that's what we want. So just keep the camera like that. Don't
leave
move
it. Leave it.
So this is the gap. This is the knee.
Can you bend that?
Bend
this is the knee now. This is the space between the floor.
Yes, I've seen it. Try to bend that knee.
Now bend it.
So bend it. This is the only extent it can be bent.
Then slide it forward.
Go forward.
Slide it forward. Slide it out. No, this is your leg. This one is not bad. You can get full range.
Yes, you can see
the only thing is this is not bad at all.
It's not full.
I know.
That's why I'm saying you can still get full range with consistency.
You can get full range.
This is the extent you can bend.
Yes.
I've seen it. Don't worry, I've seen this. So you can benefit from what we have been saying so far.
Okay.
The flexibility aspect, but in your own, because of your age and the strength you are going to need weight to add to that position. So as you are gaining, even if it's just 2 degrees, you maintain it with the movement. And you need to see me. Your case is not bad. But I was thinking the way you are describing it, maybe we'll be thinking about surgery. You may not even need any surgery if you are consistent with this. This is very fine.
Okay.
Yes, this is fine. That is fine.
Because so try after the call, try to call him personally to book an appointment of when to see him within the week.
Okay.
All right. So I think, Doc, you can continue, sir, to the next.
Okay,
we have 30 minutes, about 35 minutes.
No problem, man. Then, man, let's quickly share the video of Mrs. Atiken. So I can just point out something.
I don't know why it doesn't want to play from my system. Go ahead, sir. Let me check something.
Okay, ma. So I said after this level, that once we are done with the flexibility, we move to range of motion. Then I've showcased two, two position, the lying and the long sitting. Then another thing we can do, we can use the sitting method. So I'll show you something now, the sitting method. Sitting. That should be eye sitting. Okay, let me put the pillow. Okay, your legs are free. Okay. So in that regard, this is the other method that we can use. This method in sitting position, after you have done the flexibility, you can have a small towel here. This level, just bring that for me. Let me just use it as an example that we can have something to add here on the chair. Then you raise it up, then down. Within the available range, whatever you've gotten. It looks so simple, but it's very, very effective. So you can go the same way, up, down. That is 1, 2, 3, 4, 5, 6, 7, 8, 9, and
I'm
10.
not seeing the video.
You are not seeing the video?
Yes, sir.
Okay, you'll see it now. How is it now? It's okay.
Maybe it's from my side. I don't know, but I'm not seeing any video.
Okay. Can you see it now?
Yeah, I can see it now, sir. Yes, sir.
Oh, okay. So you just are on a chair, but that chair must be a bit high. If it is not high enough for you, put a pillow on it so that you can be higher up. Your legs must be free from the floor. Your legs should not touch the floor. You can see this, that is free from touching the floor. So you put a small towel under your knee. So whatever you have gained from your flexibility, 1. So it's the same thing we did while he was lying down, while he was sitting halfway. So I'm just giving you various methods that you can use. You get that now? So from this point, we move to strengthening exercise. Come. You can lie down. You are facing up. So for those of us that are afraid of movement, because that is one of the major challenges, what you do is this. You place a towel under the knee joint. Can you see this video, please?
Yeah,
yes, we are
seeing it. We are seeing it.
Yes,
Okay.
you can see it.
So you place a towel under the knee joint. Place the towel under the knee joint.
Sir, please, you are muted. Okay, sir. We can hear you now.
Okay, ma. Okay, ma. So put a towel under the knee joint. Then ask the child to pull up the ankle. Pull up, and press on the towel. Beautiful. Pull up and press on the towel. This is isometric strengthening exercise. This is going to help to increase the strength of the quadricep muscles. This is the quadricep muscle. And at the same time, it's going to help all other muscles. The dorsiflexor, that is the one you use to bend up the ankle. So you just instruct, pull up and press. Beautiful. Can we see the count? You just instruct the child, count 1, 2, 10. Let's go.
1, 2,
Mhm.
3,
Mhm.
4,
Mhm.
5,
Mhm.
6,
Mhm.
7,
Mhm.
8,
Mhm.
9,
Mhm.
10.
Good. Now, while we are counting, it's very important. We count for two major things because it is an isometric exercise. What is an isometric exercise? Is that you are not moving, you are not practically moving the joint. The joint, you are contracting all the muscles, but at the same time, you are building up pressure within yourself. By counting, you exhale and reduce the pressure to prevent what we call Valsalva maneuver. Valsalva maneuver is very simple. Most especially, it affects the adult more compared to children. Now, what does that mean is that for adults, if you are doing this exercise and you are not breathing, then it may increase your blood pressure abruptly. And nobody wants that. You don't want your blood pressure to go up while you're doing exercise. We don't want that. We don't want abrupt one. So it is advisable as you are doing this type of exercise, you keep counting. So by the time you are counting, 1, 2, 3, 4, it enables and encourages you to breathe consistently. So that is number 1. Number 2, it enables you to dose, to introduce dosage to exercise. By the time you count 10 times, you stop. You must have rested, say 1 minute. You count another 10 times, you count, then you repeat for 5 times. So that will have completed a bout. So as you progress, as you are getting it more, the strength is increasing, then we increase the dosage. You can increase to, instead of you counting 10, you can now say you should now be counting 20. But that counting is very important because it's going to enable you to breathe consistently. It's very important, especially for the adults. So this is the first step. You know, these exercises, they are in steps and levels. The first step to increase the strength of your muscles. Because whether we like it or not, for instance, when you are strengthening the quadricep muscles and hamstring muscles, all the muscles of the thigh, you are actually reducing the load, the direct load on your knee joint. The more strength your thigh muscles has, the better, the lower the load on your knee joint, and the lesser the bleeding episodes. Let me repeat that again. The stronger your thigh muscles are, the lesser the load of your body going to your knee joint, and the lesser the bleeds, lesser the pain, lesser deformity, tightness, and all other complications, and the better the preservation of that joint, and you now have overall increase or improved quality of life. So you can see all these things, they are interwoven. You just have to follow them level after level, stage after stage. We start from flexibility when they were bending. We move to range of motion to maintain whatever we have gained and improve on it. And you move to strengthening, not to protect the joint, not to allow frequent bleeding. The stronger the muscles of your body, the better for you, the lesser the bleed, the lesser the pain, and the more protective the joint is. If you follow all this, you now see that whether we like it or not, exercising for people with bleeding disorder is sacrosanct. Then if people without bleeding disorder too, everyone is struggling to exercise every day, then you can see that is people without bleeding disorder. Everybody is moving around, exercising, strengthening their muscles, making sure their bone health is maintained on consistent basis. Then you can see that we don't have any choice too. So if people without any bleeding disorder, they are striving every day to exercise. Yes, the stronger the muscles, yes, the stronger the muscles of your thigh, the lesser the load on your knee joint, and the lesser the bleed, the lesser the pain, the more protective the joints are, and the more preserved they are. Do we get that, please?
Yeah, yes.
Yes, sir. Yes, sir.
Beautiful. So you can see now that, like, I've taken us through flexibility to range of motion to strengthening. Now, the last one on that is proprioception. That proprioception comes last. But now we've added something to our exercise. That is, after we have exercised all the regions of our body, we now go to sports. We must now have one sporting event, which you will choose. Then we look at the risk for you, the phase, the stage of pathology. So you can see, as we are exercising, we started from flexibility, we moved to range of motion to strengthening to proprioception. Then after we've gotten all this, for us to now maintain all this, we must now put it into a sport. The sport will now ultimately help us to maintain all this together. So, but we are going to start from regions of the body. Mind you, we are still on the knee joint. And I told you why we have to emphasize the knee joint more. In the whole of our lower limbs, from our hip to our feet, the knee joint is the most affected. Then followed by the ankle and the hip joint. They have almost the same level of affectation. But the knee joint, and it's very simple because it's having 1 degree of movement with lower level of muscular support. So with what we've had now, do we understand what we have done now? And can we just spend the next 5 minutes? Let us see videos of people everybody doing this. Let me just see, let's see a short video of everybody doing this now. Even if it's just 2 or 3 minutes. We have your child there, what we have gone through this morning, from that flexibility, the one we had last month, to range of motion, from range of motion to this level, first level of strengthening exercise.
So we
Hello?
Let's have people show us their video. Okay. I think I can only see Emeka, who is doing the range of motion.
Okay.
She's the only one.
Beautiful. That's good. Okay. Please, others can join.
Have any other person?
Let's see everybody.
Yes, there's someone too. Techno Spark have also joined.
Destiny. It's a practical class. We have to start doing a lot. It's a practical class.
Mrs. Ilori, I think I was seeing your son now. I can't see him again. Good morning, Doc.
Hold something like
Haji Aramat, where's Uthman?
He has gone to school, ma.
Okay.
He went for Saturday class, ma.
Okay. Because he needs this exercise for that his joints.
Yes, ma.
You need to start doing it.
Okay, ma.
Destiny.
Mrs. Daudu, I think your son is in school too, right?
The county one too.
Mr. Cole, where is David? It's you I'm seeing. David, I want to see, not
Good.
Mr. Cole, where is David? Mrs. Abibat Afolabi is also showing her son.
Okay. Good.
Mrs. Folawi, where's your son? Timothy, let me see. Mrs. Okoye, where are your sons?
That's good.
1, 2, 3, 4, 5, 6,
Okay.
7,
I love that counting. The counting is very important.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Who is that, please? I need to give him a clap.
This is Dr. Larry.
Oh, you have to be.
Beautiful one.
Good morning, Doc.
Beautiful one.
This morning.
1, 2, stretch it very well. 3, 4, 5, 6, 7, 8, 9, 10.
Good.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
That's good. Is that Mrs. Abibat's son?
Yes.
Okay. Good
Yes,
one. Well done.
Thank
Please,
you.
the essence of this is not just for us to hear it once. Someone asked for the video. The video is going to be on the YouTube page. I'm going to put the YouTube link on all of our WhatsApp pages. You can always go back to the YouTube page and watch the video or download the video. The one for January is also there for those of us who missed the January edition. By tomorrow evening, the recording will be ready and will be put on the YouTube page for us to be going back to it to see if we are doing anything wrong. And like Doc said last month, and I'm repeating it again, you have the opportunity of, if you don't have his contact, reach out to me, I'll give it to you. Just like what was done this morning. I think I have the video now and I can share that video with us of the mother. I don't know if you can see the video. Can you see the video?
Yes, ma'am. You can see now.
This is a mother sending what she learned last month. And this is what we want. As you do this thing, send the video. That will help. You can see the boy playing with the tap. So the 15, 20 minutes we pass without him even remembering. Even when you tell him it's time, because of the game he's playing.
Relax it. Holding it. Leave your leg. You're holding it tight. You're not allowing it to pull down.
Good. Beautiful. Well supported. I loved it.
Mm. Huh?
Beautiful. Beautiful. Okay, you wait. Stretch down. Almost down there.
We're almost done.
They captured that. Love this.
So we encourage, want to see more of this. So if you send these videos, if there's anywhere you are making a mistake, we'll be able, the doctor will be able to advise and correct. If there's what we need to improve, we'll be able to advise, even if it's not close by with you. So thank you. I'm going to stop sharing that video. So thank you, Madam, for sending in that video, and well done. It was a good one.
So, any
Yes,
further question
for you here.
Ma?
No, she's clapping, and I said I'm also clapping for her here. She did a good job.
Yes, she did a good job. So we are expecting another one for next month, so that we can compare, so people can see that as you are doing this thing, you'll be improving all the time.
So if I may add something, we have learned 3 things now. Like doctor said, we move from flexibility to range of motion, and then to strengthening.
Yes, ma'am.
You need to practice them. Don't just stay only on flexibility.
No.
Without flexibility, you need to also do range of motion, and you also need to do strengthening.
Yes.
For a lot of these boys, I have noticed the wasting of the muscles of the thigh. And it is that strengthening that will build it. Some of you will always say it. The upper leg is thin. One leg is thinner than the other. It is that strengthening that will build those muscles back.
Yes.
So all of these different exercises have what they do. If you just get range of motion and you are not strengthening, it's not going to help you. If you are only stretching and you are not getting range of motion, it's also not going to be we are not going to see the whole essence of what we want to see. So as you are getting your range of motion, your flexibility, like you said, if all you get is just 3 inches or 3 degrees that you are able to get, now do the range of motion to maintain it, then strengthen the muscles around that place so that you don't have a bleed. I love that phrase, and you see that I've gone to put it on the HFN WhatsApp page, even for those who did not join. This is something that we need to have. Let that word become like a memory verse in our head. Let it be our hemophilia memory verse. The stronger your muscles, the lesser the load on your knee, and the lesser the bleed, and the more protective you have of that joint. Please let this be a memory verse. Teach it to those children. As a patient, let it be. So when you are doing your exercises, you know that you are trying to gain strength, and this strength will reduce the number of bleeds that you have. And that's why some of you will see, because these joints are not strengthened, that's why somebody will just sit down. After sitting down for a long time, a small movement on the joint will cause a bleed.
Yes.
Because the joint the muscles around that place is weak, you have not been using that joint, a small activity on a joint will cause a bleed. So this is a very, very strong statement that we need to all have in our head. The stronger your muscles, the lesser the load on those joints and the lesser the bleed on that joint and the more protective those joints become. Do we have any final questions before we round up? We have 10 more minutes to go. If you have any questions, please raise your hands or put it in the chat box if you cannot speak. So we just take or we give Doc the remaining 10 minutes to round up for us. Okay. Oluwaseun John, you have your hands up. Unmute and ask your question, please.
Yeah, good morning, everyone.
Good morning.
Actually, I'm 26.
Okay.
I'm the patient. About 3 years ago, though, I came to know over the years when I was young, I used to have swollen knees, then my joints, I'm not like others. I can't bend the knees well. Sometimes it's being painful. Then I relocated to about 4 or 5 years ago. Then 3 years ago, 2021 precisely, I just noticed that I couldn't stand straight again from the hip. Yeah, I noticed and I was having severe pain then. I couldn't stand straight again. So then I was referred to National Hospital. Then we didn't know on time what was really wrong. Then I did CT scan. They said there was a pulse or something. So it was after surgery. I did surgery then. The bleeding didn't stop. So it was from the hospital I did surgery. Then they called the hematologist. Then we later came to know that it was an hemophilia. Then I took factor then. So after the surgery, happened to relocated back to my village at Kwara State. Then I couldn't even access factor, though I used to follow up the people from the WhatsApp or due to financial strains and other things. So, and I couldn't do much of stress. So I haven't come back to Abuja since after that time. But I used to follow up some things on the WhatsApp page. So my question is sometimes that it was actually the left leg then. I used to still have this numbness, like blood is not flowing well around that thigh, even till now. Sometimes I actually have my leg. If I pull the hair, I will not even have that feelings. Like I won't feel like I'm in the hair. Like I'm still feeling that numbness around my thigh. I don't know if there's any kind of exercise you can be doing to help the flow of blood.
Oluwaseun, before we go to exercise, I need to just get some. You said you are 26 and you were
Yes,
not diagnosed until 2021.
Yes,
so
ma'am.
that means you were diagnosed at 23.
Yes, ma'am.
And you were diagnosed after a surgery and prolonged bleeding.
Yes,
The numbness you are feeling, is it on the same joint that was operated on? Is it on the same leg that was operated?
Yes. Yes, ma'am.
Okay. Secondly, you said you are back to Kwara State. Where exactly in Kwara State are you?
It's actually a remote, one of our remote village around Umuaran precisely.
Where
But
is
though
between Umuaran and Ilorin and Umuaran and Abuja, which is closest to you?
Ilorin is actually closer, but I will be moving back to Abuja next week actually.
Permanently, or to come back again to Umuaran?
No, I'm planning to stay there permanently.
Okay, because there's you see, this is some of the things. I just want to use this opportunity to talk to parents. This thing has happened in the last, I think you are the third person in the last 3 weeks or 2 weeks. If you You have to move from one place to another. Please let us know. You wouldn't have been since you moved back without factors, because there's a treatment center in Ilorin. So all we needed to do, well, I was just to have connected you with the doctor. Your doctor in Abuja will just let her know you are in there, and then you'll be receiving your treatment over there in Ilorin. So if anybody needs to travel or you need to relocate, it's not the end of your treatment. The foundation is trying as much as possible for us to have treatment centers in state. Currently, we have 10 states. So there's going to be somewhere close to you where you can access treatment. So after the meeting, Oluwaseun, I and you will talk aside your exercise on how you can, because I'm just seeing your name even for the first time. We'll talk more and get to know each other. You say you're on the WhatsApp group of the North Central, right?
Yes, ma'am.
Okay, so definitely you have my contact.
Definitely, ma'am. Yes, I do, ma'am.
Chat me after the meeting and then we can talk. Let me allow Doc to reply to you on the issue of if there's any exercise for that numbness.
All right, thank you very much, ma'am.
Okay, Mr. Oluwaseun, well, good to hear from you. Well, it's still an ongoing process. You see, your numbness is not as a result of lack of blood flow. That is called compartment syndrome. And you said right from the onset that you were having challenge standing straight from your hip. Then there could be possibility of iliopsoas, that is hip flexors muscle bleed, then coupled with the aftermath of your surgery, then that numbness is as a result of pressure from your muscles. Whether I would like it or not, that needs a thorough assessment. For now, yes, we need a thorough assessment. And like we know, the iliopsoas, the thigh, especially the quadricep muscles, we are always very, very careful because we have very important and sensitive nerves around that area and even blood vessels. So, number one, I'll still need to see you. I may not see you physically. Maybe after we need to do a comprehensive chat in a private place where you can show me where you're having.
When it gets back to Abuja,
beautiful.
Then you connect with the physiotherapists there together with Doc
yes,
pathologist.
exactly.
A conference call or video conference call that all need to see you. So we'll take your case.
But the good news, yes. But the good news is that you are going to be better. You know, your prognosis is very fair at your age. So, but we need to just see, examine you, then we now put you your own exercises and depending on your own needs too. What do you do for a living? What kind of job and all that? So I think it's better when you get to Abuja, we'll find a way to link up with you.
Technospark Geo. Yes, I can see you raising your hands. Unmute and ask your question. I'm so happy a young boy wants to ask question by himself. Go ahead. Okay. Go ahead and ask your question. What's your name? Technospark Geo 2021. You are raising up your hands. Okay, it's trying to show his exercise, sir.
Okay. Now, let me try and watch. Okay.
Can you unmute?
Pull up your ankle. Let's see. Can you pull up your ankle?
Who is that?
Can you pull? Okay. Then slide it down. Okay, Destiny.
Okay.
Destiny. Okay, I've seen that. Destiny is my boy.
Okay, so Emeka, I think you are the final person who will take your questions now.
Okay. Thank you, ma'am. Doc, I wanted to ask you a question regarding this because formerly I was having the pain on my knee, although I've not been having pain on that knee particularly. But I think what's happening to me now is that because I'm no longer using the right knee very well, so I think all my weight went to the left. So recently, since all this year, about 2 years ago, I've been having since 2 years ago, I've been having bleach on my left thighs and hip here. So I don't know exactly what, because it's often kind of maybe for sometimes 2 months, 1 month, sometimes it comes 2 times in a month. Recently it comes, I'm still on it now, it's still there, kind of. Although I'm not having pain, I'm having little pain, but the thighs still hard on it. So I don't know what to do to reduce this thing. That's why I was showing the right knee, because if you look at the right knee, the right thigh is kind of thinner than the left. So I think my weight went more on to the right. But I can't stand straight. And because even the leg, if I stand straight, try to push the leg to stand straight, I can stand straight, but with if I come, that is kind of, it will just push back again.
Emeka, please try and go and see Dr. Karim this week.
Okay.
We need
it's very, very good for you.
You need a full assessment. Try to call him after this meeting and book an appointment to see him this week, please.
Okay.
Mrs. Josie, you asked, you say, how do I control continuous bleed on the ankle of my son? You need to think of which activity is he doing.
Exactly.
What are the activities that is causing the continuous bleed? And then, like we said, he also needs to build the muscles around that ankle. So first, let's know the kind of activities he's doing. Yes, he might be telling you he's not doing anything. It just starts like that. But there's a way we can actually get the truth from them about what activities we are doing. Like someone like Emeka, I think we spoke. That's why I said he needs to see Dr. Karim. He's a businessman that is always on his toes throughout the day in the markets trying to sell things. So if you are not balancing your movement on both legs, you will definitely be having bleeds on that other leg that is bearing all your weight. So we need to get that right leg back functioning so that both legs can carry the weight. And that's why you must see. So we need to know what your son is doing. That's the only way we can control that bleed. Until we're able to control his activities, we cannot control the bleed. Finally, Techno Pop 5 Pro, you have your hands up. Do you want to ask a question? Please unmute and ask that we can end the session. Okay, it's not asking. So on behalf of everybody here, I would like to thank Dr. Karim for your time, for your patience, for your commitment to this community. I want to appreciate every parent that are here for the meeting today. I'm sure you have all learned 1 or 2 things. And please, I want us to practice this thing. It's not just about here. Let's continue to do this practice and we're going to see the improvement. And by next month, I want to see more videos, not just from Mrs. Ezike alone, more videos. And like Doc said, please get a tape rule. Please, let everybody get a tape rule. Before you start this exercise, measure from your from that knee to the floor. What is the number of inches you have? then try to measure it exactly 1 month when we are the day we are having the next meeting. Then you'll be able to know if there's improvement or no improvement. We're supposed to be getting that knee closer and closer to the floor as much as possible. So that's a way you can, even if you cannot measure angle, let's measure in inches from the knee to the floor. How many inches is it? And you check it weekly. That will let you know if what you are doing is making any effect. So thank you so much and enjoy the rest of the weekend. Thank you, Doc.
You're welcome.
Thank you, Doc. Thank you, Ma.
Welcome,
You're welcome. Thank you, everyone. Bye.